5 on your health tonight. A sudden surge in the number of Americans diagnosed with strep throat. Here to answer your questions is Dr. Daniel Kiritzkis, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you, Doctor.
Hey, Dr. Kiritzkis. Thanks for your time. It's great to see you. So we're learning today that researchers reviewed more than 100 million health records from this past winter and found the cases rose 30% higher than the previous week back in 2017. So A, that's a gap in time, right? That's what, 6 years ago. And B, what's your reaction to that?
Well, it's good to see you, Ed and Jessica. Yeah, there has been a dramatic increase, but I think it's very similar to the increase that we've seen in influenza and in RSV. You know, people were sheltered, they were not in contact with other people. And so as we've seen an increase in other respiratory infections, we've also seen an increase in cases of strep throat that we know track with influenza and RSV, probably because these viral infections can damage the lining of the throat and allow strep to invade where it might ordinarily not have. And also because as people cough, they're more contagious and may be more likely to spread strep from person to person.
Well, as you know, in December, the CDC issued a national health alert about an increase in invasive group strep infections. Is there anything you can tell us about those cases?
Yeah, so this was about 34 children who had what we call invasive strep infections, more serious than just strep throat, in Colorado and Minnesota, two sentinel surveillance sites where they track the incidence of these kinds of infections. About 60% of them had a pre-occurring respiratory infection, but 20% had no symptoms before they got ill. We think that what's happening is just as the same with the increase in flu and RSV cases, because there weren't these cases or exposures during COVID, people's immunity may have waned to strep and allowed more of these invasive infections to occur.
So, Dr. Kiritzkis, correct me if I'm wrong, but the season for strep typically is December to April, right? So we're still in April, so it's not over yet. So what do you want people to know about getting tested and therefore getting treated?
Well, you know, if you have a severe sore throat where you have fever, swollen glands associated with that, difficulty swallowing, or you're hoarse or having trouble breathing, all of those are signs of a severe infection. You can get tested at an urgent care center or in your doctor's office. The rapid tests are very similar to the COVID rapid tests, except they're not available to you. It has to be done through a healthcare provider. And then treatment is pretty simple as well. Most strep are very sensitive to penicillins. We typically use amoxicillin because it can be dosed less frequently. And the only issue here is that certain formulations of amoxicillin liquid for young infants are in short supply. And so it may be necessary to get an alternative medication, and you can just check with your pediatrician about that.
Great advice as usual, Dr. Kiritzkis. And before you go, because you and I don't chat all that much, have you added any CDs to your collection behind you? In the time that we've been, because I don't know, I can't tell.
No CDs recently, but more programs.
More programs. Very good.
Very good.
Celebrity series.
Great to see you, Dr. Kiritzkis. Thanks for your time.
You're welcome.
Take care. Bye-bye.